Hello everyone, my name is Patricia Sims, and this presentation will cover oppositional defiant disorder, also known as ODD. Did you know that oppositional defiance disorder is also connected to emotional disturbance and conduct disorder? Basically, emotional disturbance has 6 categories, and a few of those categories include anxiety disorder, bipolar disorder, and conduct disorder. Conduct disorder basically is similar to oppositional defiant disorder, except the student would display more severe behavior in terms of being destructive or violent and even committing serious violations. When it comes to oppositional defiant, if people don't support the student and help them learn to manage their behaviors, eventually it could lead into becoming conduct disorder. So, what is oppositional defiant disorder? Basically, ODD develops during the preschool years or before early teen years. And children display emotional and behavioral symptoms from that last at least 6 months. And there's patterns. So basically, they show patterns of being extremely angry or being defiant and vindictive towards authority figures. And the symptoms can vary depending on the child. So there's a mild form of ODD, moderate, and severe. Mild would be maybe these behaviors only occur in one setting. So at home, it happens, but it doesn't happen at school. And moderate would be the behaviors happen in at least 2 settings, and severe would include 3 or more settings. So, ODD behaviors, which I previously said a few of them, but I wanted to elaborate a little more. These students would be angry, so they would frequently lose their temper, and they also would be resentful to people. They definitely would be argumentative, so they often argue with people in authority, whether that's a parent or a teacher. They can be irritable, so they would be touchy and easily annoyed by others. So, simple things that you say to them could set them off. And they're vindictive, not all of them, but they're vindictive. And they can be spiteful or seek revenge against others. So, what does ODD look like in the classroom, and what are some challenges that teachers might encounter? Basically, they refuse to follow the rules and requests. They also argue often with the teacher or adults, and they basically attempt to annoy or upset others around them. So they're not paying attention and they're distracting their classmates from the lessons. They also blame others for their behaviors or their mistakes. So if they get in trouble or they get called out for something, they will blame other people for it. And they have repeated temper tantrums. So they're constantly throwing a fit or being frustrated or being angry. Now, some of these behaviors may sound like traditional students that you have in your classroom, but I want you to keep in mind that ODD basically the behavior is frequent and it lasts for at least 6 months. So remember that. So, some effective ODD strategies. Parent training. So we want to provide parents like with the help so that they can learn to manage their child's behavior. In terms of therapy, you can provide individual or family counseling. And of course, if you feel like the student or the family needs long-term counseling, then you definitely want to refer. In the case of problem solving, you want to create opportunities for the student to develop skills and to be able to identify patterns of ODD, so patterns that are affecting them. And for social skills, you want to offer classroom lessons and group counseling so that they have the opportunity to interact with their peers. For trauma informed, that's for educators or even staff. You want to be mindful of possible traumatic experiences that these students may have had, and you want to implement teaching strategies and policies that meet their needs. And lastly, environment. So, what I mean by environment, you want to make sure that you're creating a predictable classroom or home environment so that the student can um, see examples and learn appropriate behavior. These are just a few of the curriculum options that I found. And so peace basically is designed to increase empathy skills and basically help them learn to interpret social cues. And paths is basically for promoting alternative thinking strategies. And basically, you want this is to help them focus on emotions and empathy as well. And PSST basically is problem solving skills training. And definitely the students can use this to learn to navigate what's going on with them. And lastly, parent management training, PMT. You just want to make sure that like I said earlier, you're giving the parents the tools to support their child. Thank you for watching my video on oppositional defiant disorder, and I hope you found this information useful. And these are my references. Thank you.